Welcome to Mihira's English Listening Test for Healthcare Professionals. Sample Test 2. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You will have time to read the questions before you hear each extract, and you will hear each extract once only. Complete your answers as you listen. At the end of the test, you will have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes to extract 1. Extract 1. Questions 1 to 12. You hear a neurologist talking to a new patient called Mihira. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon. How can I assist you today?
Hello, doctor. I've been experiencing some concerning symptoms lately.
I'm here to help. Could you please describe your symptoms?
Sure. I have a debilitating condition that's been causing me a lot of distress. I also have this low isolated pain that seems to come and go.
I see. Mihira, can you tell me more about the nature of your symptoms and any triggers?
Well, the pain seems to be accompanied by a stiff neck, and I've noticed some swelling in my glands as well. I've been feeling quite fatigued lately.
Have you experienced any other issues such as changes in vision, coordination problems, or weakness?
No, not really. But I should mention that I'm currently taking cod oil B12 for a separate issue, and I've had some ongoing struggles with acne.
Thank you for sharing that information. Mihira, can you tell me about your medical history?
Well, I am a journalist, so my work can be quite demanding. Aside from that, I don't have any significant medical history.
Have you had any recent injuries or infections that might be related to your current symptoms?
No, I haven't experienced any injuries or infections recently.
I'd like to conduct a thorough neurological examination to better understand your condition. Mihira, this will help me determine the best course of action moving forward.
Sounds good, doctor. I'm eager to find out what is causing these symptoms.
Based on your description, it's important for us to investigate further. Mihira, we may need to run some tests, and possibly order imaging studies to get a clearer picture of what's going on.
I appreciate your help, doctor. I'm looking forward to getting to the bottom of this.
Rest assured, Mihira, we'll work together to reach a diagnosis and develop a suitable treatment plan. Let's start with the examinations and take it from there.
Extract 2. Questions 13 to 24. You hear a consultant gastroenterologist talking to a patient called Mihira. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mihira. How can I assist you today?
Hi, doctor. I've been experiencing some digestive issues lately.
I see. Can you describe your symptoms for me?
Sure, doctor. I've been having gastric flu and abdominal discomfort. Sometimes, my stomach feels really swollen.
I understand. Have you had any fever or diarrhea or any recent changes in your bowel habits?
No fever, but occasionally I've had loose stools.
All right. Mihira, have you ever had a barium enema or a colonoscopy before?
No, doctor. This is the first time I'm seeking help for these issues.
Got it. Can you tell me about your medical history and any medications you're currently taking?
I don't have any major medical history, and I'm not on any medications.
That's helpful. Have you had any tests or treatments for your symptoms so far?
No, doctor. This is my first visit regarding these symptoms.
All right. Mihira, let's proceed with a physical examination. Your weight is 132 pounds and your height is 5 feet 4 inches. I will also recommend some diagnostic tests to further evaluate your condition.
Okay, doctor.
Given your symptoms, we might consider performing a barium enema and a colonoscopy. These tests will help us get a clearer picture of your gastrointestinal health.
Sounds good, doctor.
Now, let's go over the next steps. I'll provide you with instructions for preparing for the tests. It's crucial that you follow these guidelines to ensure accurate results.
Of course, doctor. I'm a bit apprehensive about these tests, but I understand their importance.
It's natural to feel nervous, Mihira, but the tests are routine and will help us identify any underlying issues. Before the procedures, we'll discuss any potential risks, so you're well informed.
That sounds reassuring. I'm ready to proceed with the tests and get a better understanding of the unfolding developments.
I'm here to help you every step of the way, Mihira. Remember, you're not alone in this journey. If you experience any exacerbation of symptoms or have questions before our follow-up, don't hesitate to contact my office.
Thank you, doctor, for your understanding. I'm feeling more hopeful about resolving these issues with your expertise.
You're welcome, Mihira. We'll work together to address your concerns and get you feeling better. In the meantime, focus on following the preparation instructions closely. If you think of any questions later, feel free to reach out. Stay positive.
I will, doctor. Thanks again for your time and help. I'll make sure to follow the instructions carefully.
That's the spirit, Mihira. Take care of yourself, and we'll be in touch soon. If anything comes up, don't hesitate to reach out. Have a good day.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now, look at question 25. You hear a nurse telling her supervisor about a medication error she made a few moments ago. Now read the question.
So, how's today gone, Mihira?
Well, I'm afraid I made a mistake with Mrs. Lee's medication. I've given her the wrong dose of insulin. She's diabetic and she needs 10 units of insulin before each meal. But I accidentally gave her 20 units instead. I realized my error when I checked the syringe after injecting her.
Oh, that's serious. How is she now?
She's She's stable. I immediately notified the doctor and he ordered some glucose infusion to counteract the insulin overdose. He said she might experience some symptoms like sweating, trembling, or confusion, but they should subside soon.
Well, I'm glad you acted quickly and reported the incident. But you need to be more careful with medication administration. Insulin is a high-alert drug and any error can have severe consequences.
I know. I'm so sorry. I don't know how it happened. I guess I was distracted by the noise in the ward and I didn't check the label properly.
Well, that's no excuse. You need to follow the 5 rights of medication administration every time. Right patient, right drug, right dose, right route, and right time. And you need to document everything you do.
Yes, you're right. I'll do that from now on. I've learned my lesson.
Well, I hope so. This is a serious incident and it will be recorded in your file. You'll also have to attend a remedial training session on medication safety.
Okay, I understand. Thank you for your guidance. Question 26. You overhear the ward manager discussing the implementation of mobile computing solutions in the hospital. Now read the question.
We're excited about the upcoming changes in our hospital's workflow. We're introducing mobile computing to enhance our patient care processes. With these new mobile devices, our medical staff will be able to access patient records and update treatment plans in real time, no matter where they are in the hospital. This technology will enable us to streamline communication between different departments, ensuring that lab results, radiology images, and consultations are readily available to the entire treatment team. By integrating mobile computing into our practices, we aim to achieve a seamless and efficient patient care experience, reduce the risk of errors, and ultimately improve patient outcomes. This marks a significant step towards our commitment to providing the best possible care.
Question 27. You overhear a nurse discussing a newly admitted asthma patient with a colleague. Now read the question.
Hey, have you heard about our new admission, Mihira?
Yes, I was just reviewing her case. She's a 45-year-old female with a history of severe asthma.
That's right. She came in through the emergency department last night. Her asthma symptoms were exacerbated, and she was having difficulty breathing.
I see. What's the current plan for her care?
The doctor has started her on nebulized bronchodilators and corticosteroids to help manage the acute exacerbation. She's also on continuous oxygen support.
Got it. Are there any specific concerns we should watch out for?
Definitely. Given her history, we need to closely monitor her respiratory rate, oxygen saturation levels, and any signs of respiratory distress. The doctor mentioned that she's at risk of respiratory failure if we don't manage this episode properly.
Understood. I'll make sure to keep a close eye on her and follow the prescribed treatment.
Question 28. You overhear a dentist explaining a root canal procedure to a patient. Now read the question.
Good afternoon, Mrs. Mihira. How can I assist you today?
Hi doctor. I've been experiencing some pretty intense tooth pain, especially when I eat or drink.
I'm sorry to hear that. Based on your symptoms in our examination, it looks like you might need a root canal procedure.
Root canal? Is that really necessary? I've heard it's quite painful.
I understand your concerns, but let me explain the procedure. A root canal is performed to save a severely damaged or infected tooth. It involves removing the damaged pulp from inside the tooth, cleaning and disinfecting the area, and then sealing it up. It's actually done to relieve pain, not cause it. Modern techniques in anesthesia make the procedure relatively painless. The pain you're feeling right now is likely due to the infection, and a root canal can help alleviate that.
Will my tooth be okay after the procedure?
Yes, absolutely. Once the infected pulp is removed and the tooth is sealed, we'll likely recommend a crown to protect and restore its function. This should eliminate the pain and allow you to use the tooth normally.
How long does the whole process take?
The procedure itself usually takes a couple of hours, but it might require more than one visit depending on the complexity of the case. We'll ensure you're comfortable throughout the process and that you understand each step before we proceed.
I see. Thank you for explaining it clearly, doctor.
Question 29. You hear an eye specialist talking to an elderly woman about her vision issues. Now read the question.
Good afternoon, Mrs. Mihira. How can I assist you today?
Hello, doctor. I've been having difficulty seeing things clearly, especially when reading or watching television.
I see. How long have you been experiencing these vision problems?
It's been going on for a few months now. I've also noticed that my vision seems to be getting blurry, even when I'm just looking at things in the distance.
Thank you for sharing that. Mihira, have you ever worn glasses or contact lenses before?
Yes, I used to wear reading glasses, but they don't seem to be helping much now.
I understand. Based on your symptoms and history, it's possible that you might be dealing with age-related changes in your eyes, such as presbyopia. This is a natural condition, where the lens of the eye becomes less flexible over time, making it harder to focus on close objects.
Is there anything that can be done to improve my vision?
Absolutely. We can prescribe you new glasses, designed to address presbyopia. They might be multifocal lenses, which allow you to see clearly at various distances. Alternatively, we could discuss contact lenses or other vision correction options.
I'm concerned that it might be something more serious.
It's always good to be cautious, but your symptoms align with a common age-related condition. Still, to rule out any underlying issues, I recommend a comprehensive eye exam. This will give us a complete picture of your eye health.
That sounds like a good plan. Thank you, doctor.
Question 30. You hear a nurse briefing her colleague about a patient who fell from bed. Now read the question.
Ms. Mihira had a bit of an incident last night. She fell out of bed while attempting to get up on her own. She didn't seem to lose consciousness, but she did hit her head on the bedside table during the fall. We checked her out thoroughly, and there are no signs of major injury. However, I've informed the doctor about the fall, and we've ordered a CT scan just to be cautious. She's currently resting and seems stable. Her vital signs are within the normal range, and we're keeping a close eye on her for any changes.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now, look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with a nutritionist named Dr. Mihira, who is an expert on multivitamins and their effectiveness.
Today we are joined by Dr. Mihira, a renowned nutritionist and expert in the field of dietary supplements. Dr. Mihira, could you shed some light on the topic of multivitamins and their effectiveness?
Of course. Multivitamins are dietary supplements that contain a combination of various vitamins and minerals. They are marketed as a convenient way to ensure individuals meet their daily nutrient requirements. However, their effectiveness has been a subject of debate within the medical and nutritional communities.
Can you explain why there is such debate surrounding the effectiveness of multivitamins?
Certainly. On one hand, proponents of multivitamins argue that they can fill potential nutritional gaps in people's diets. Many individuals don't consistently obtain all the necessary nutrients from food alone, and multivitamins can act as a safety net. On the other hand, critics point out that relying solely on multivitamins can't replace a balanced diet. Additionally, some studies suggest that excessive intake of certain vitamins and minerals through supplements might lead to adverse health effects.
Are there specific groups of people who might benefit more from taking multivitamins?
Yes, certain populations can benefit from multivitamin supplementation. For instance, pregnant women often require higher levels of certain nutrients like folic acid and iron. Older adults might also have difficulty absorbing nutrients from food, making supplements helpful. People with specific dietary restrictions, such as vegans or those with food allergies, might find it challenging to obtain all the necessary nutrients from their diets alone.
What about the general population? Should everyone be taking a daily multivitamin?
The general recommendation is that most healthy individuals can obtain the nutrients they need through a balanced diet, while supplements may seem convenient. Ideally relying on supplements, I encourage people to focus on consuming a variety of nutrient-rich foods. Whole grains, lean proteins, fruits, and vegetables offer a wide array of vitamins and minerals that work synergistically for optimal health.
It sounds like individual dietary habits play a crucial role. But with the supplement market booming, how can consumers make informed choices about multivitamins?
That's an important question. When considering a multivitamin, it's essential to read the label carefully. Look for products that provide close to 100% of the recommended dietary allowance for most nutrients. Be cautious of megadoses, as excessive amounts of certain vitamins and minerals can have negative effects. Also, consider your own dietary habits and consult with a healthcare professional before starting any new supplement regimen.
Dr. Mihira, what do you think is the most common misconception about multivitamins?
One common delusion is that if a little bit of a nutrient is good for you, then more must be better. This isn't necessarily true, nor is it completely false. Taking more nutrients and more nutrients is foolhardy. Nutrients work together in complex ways, and excessive intake of one nutrient can sometimes interfere with the absorption or utilization of others. As moderation is key, so is balance.
Lastly, are there ongoing studies or research to determine the effectiveness of multivitamins?
Yes, research in this field is ongoing. Scientists are trying to understand how different nutrients interact and whether certain combinations of multivitamins can provide unique benefits. However, it's important to note that a balanced diet remains the foundation of good nutrition. While supplements perhaps be helpful in exact situations, they shouldn't replace whole, nutrient-rich foods. That is the end of Extract 1. Now, look at Extract 2. Extract 2. Questions 37 to 42. You hear a dentist named Dr. Mihira giving a presentation to a group of dental hygiene students. You now have 90 seconds to read questions 37 to 42.
Greetings everyone, I'm Dr. Mihira, a dentist with over a decade of experience, and I'm excited to talk to you about the critical role of communication in dental care. As we delve into this topic, I'll share a captivating case that highlights the significance of clear and compassionate patient interactions in our field. However, before we dive into the case, let's take a moment to explore why communication holds such a pivotal place in dentistry. Dentistry goes beyond just teeth. It's about overall well-being. We're not only addressing cavities and gum health, but also enhancing a person's confidence and quality of life. To achieve this, communication is our most potent tool. Effective communication ensures patients understand their dental conditions, treatment options, and the importance of preventive care. Consider the case of John, a middle-aged patient who walked into my clinic with severe tooth pain. Now, many professionals might jump right into diagnosing the issue and suggesting treatments, but my approach involves more than that. I began by asking John how he was feeling, both physically and emotionally. This simple question opened the door for him to express his anxiety and fear of dental procedures. John's past negative experiences had left him terrified of dental visits. It underscores that our role is not only to fix physical problems, but also to provide holistic support, considering the patient's emotional well-being. This case illustrates why effective communication is paramount. Instead of rushing to provide a treatment plan, I took the time to empathetically listen to John's concerns. I explained each step of the process in simple terms, addressing his fears and reassuring him. By doing so, I built trust, and that trust laid the foundation for successful treatment. Effective communication acts as the linchpin for a range of factors that shape the overall patient experience, from informed decision-making and treatment compliance to fostering a sense of partnership and care. Let's talk about dental anxiety for a moment. It's a real barrier that prevents many individuals from seeking care. Our communication skills can break down this barrier. By creating an environment where patients feel safe discussing their anxieties, we can tailor our approach to suit their needs. For instance, with patients like John, I might incorporate distraction techniques during procedures, explain sensations they might experience, and always pause if they need a break. These measures not only make the procedure more manageable, but also empower patients to overcome their fears gradually. This approach not only helps patients feel more comfortable, but also showcases how our communication proficiency directly influences the quality of care and the overall patient experience. Now, let's talk about preventive care. It's easier to maintain a healthy smile than to address issues when they escalate. Through effective communication, we can educate patients about the importance of regular checkups, proper oral hygiene, and dietary habits. Imagine a scenario where a patient understands how their diet affects their oral health. They're more likely to make mindful choices. However, the impact of effective communication extends even further. In conclusion, effective communication isn't just about conveying information. It's about understanding patients as individuals. By listening to their concerns, fears, and aspirations, we can provide tailored care that transcends the dental chair. John's case reminds us that compassion and clear communication can transform dental visits into positive experiences, fostering trust and ultimately improving oral health.
That is the end of Part C. Now, you have 2 minutes to check your answers.